question which we'll tackle. This one cycles around severe anemia. Okay, this question cycles around severe anemia, and the question is asked like this: a 5-year-old boy was brought to the EPU, that's the what, emergency pediatric unit. So the child had complaints of fever, restlessness. So on examination, you saw that the child was pale, like the skin color is not bright like this, it's just dull. Okay, tachypnea, he was having difficulties in breathing. Tender hepatomegaly, so the liver enlarged, okay, for over 6 centimeters. Then the PCV was just 15%. So what are the questions asked under this? They said, what is the likely diagnosis? They said, I outline the management for this patient. So this kind of question like this is trickish. If you miss out the diagnosis, of course you missed out the treatment. Do you understand? So it's always good to, but can you see the way they are bringing PCV here? Once they are bringing PCV and Pallor, just know that it's a blood related problem. Okay, so here I have it that the likely diagnosis is what? Severe anemia in a 5-year-old child. Okay, so what are the features? You have to defend your diagnosis. Like, what made you to say this is severe anemia? You must explain. Okay, in Nigeria they say you explain. Okay, so there's Pallor, there's severe Pallor, and the PCV is 15%. For Christ's sake, normal PCV should be about 33 to 40. Okay, for that age. Do you understand? So PCV of 15% is an emergency, it's life-threatening. Okay, so tachypnea and restlessness because there's low oxygen supply, because red blood cells are not much to be circulating stuff, you know. Tender hepatomegaly, okay, probably baby there was an underlying infection such as malaria. Okay, so mostly we are Africans, so we actually always discuss what we see around. So in African setting, the most likely underlying cause is severe malaria, anemia. Okay, but first of all, you could just say anemia in general. Okay, then later on I'll say probably another underlying cause is malaria, you know. You understand? So you please, you always give differential diagnosis, even if they don't ask you, at least 5. Okay, so other differential diagnoses could be nutritional anemia, could be hemoglobinopathies, like the baby had what, sickle cell disease. Do you understand? Or other chronic infection. Please always give differential diagnosis. Now outline the management. First of all, you have to admit the child to the emergency pediatric unit, that's the EPU. So you ensure the ABCD of resuscitation. So make sure that the airway is clear, the child is breathing, the circulation is cool. Okay, oxygen therapy if the oxygen circulation is reduced. Keep the child warm. Okay, there should be no cases of hypothemia. Okay, they keep the child calm. Okay, so that as the body is not doing too much work, the oxygen demand will be low. Do you understand? So specific management now. The PCV is low, 15%. You have to transfuse. Okay, so blood transfusion is indicated because of the PCV. So you transfuse packed red blood cells because the red blood cells that is deficient. Okay, so monitor for transfusion reactions and all of that, you know. So if malaria is suspected, you have to now what, initiate anti-malaria therapies, drugs like what, intravenous artesunate, oral what, artemisinin. Do you understand? So you can see how it's making sense now. So if it is nutritional, you must bring your differential diagnosis here. If it is nutritional anemia, I tell them that I will feed the child well, iron supplementation. Do you understand that kind of thing? There is hemoglobinopathies. You have to just manage it based on the hemoglobinopathy. It could be thalassemia, could be sickle cell disease. Supportive cares. Keep monitoring the vital signs and the urine output and how the urine is looking like. Is there protein in urine? Is there blood in urine? Okay, then consciousness level. So maintain hydration but avoid fluid overload. Okay, then if it is fever, treat with what? Antipyretics like paracetamol, non-steroidal anti-inflammatory drugs. Then if it is a bacteria, if there is a bacterial infection, you go in for antibiotics. Okay, so for the follow-up and long term, you have to always investigate the cause of anemia. Okay, do all those blood smears to see if there's malaria, parasites in it. Do you understand that kind of thing? Hemoglobin electrophoresis to see if there's sickle cell disease or thalassemias. Then if it is nutrition, obviously you just have to rehabilitate and make sure that the baby is feeding well and all of that. So that's a